If you take a pill every single morning, metoprolol, hydrochlorothiazide, or verapamil, I want to ask you something. Not what the label says, not what the pharmacist printed on the bag. Do you actually understand what that pill is doing inside your body right now? The way it works, the way it can quietly turn on you, and the warning signs that separate a minor inconvenience from a situation that needs urgent medical attention. Most people pause when I ask that question. Educated people, careful people, people who manage their own finances and read the news. They pause. And that pause tells me everything. Because these are not gentle medications. These are not vitamins. Metoprolol, hydrochlorothiazide, and verapamil are powerful drugs. They change how your heart beats. They change how your kidneys filter. They change how your blood vessels respond every single day. And yet millions of seniors take them on autopilot, with very little understanding of what to watch for, what to avoid, or when something ordinary is actually a warning signal. Today, I am going to change that. My name is Dr. Walker, and this channel exists for one reason: to give you clear, honest, practical health information, the kind that too often gets left out of a 10-minute doctor's appointment. By the time this video ends, you will understand these 3 medications in a way that makes you safer, more confident, and far less likely to be caught off guard. Before we begin, tell me your name and where you are watching from. I go through every comment, and I genuinely want to know who I am speaking to today. Now let me tell you about a woman named Margaret, because her story sets up everything we need to cover. Margaret was 69 years old, a retired school teacher. Sharp, organized, careful. She had managed her blood pressure for 6 years without any major problems. Then her cardiologist added verapamil to her regimen. Margaret nodded, picked up the prescription, and went home. Nobody explained what verapamil actually is, how it works differently from what she was already taking, or what ordinary combinations could make it quietly dangerous. 8 weeks later, Margaret started feeling a strange heaviness in her chest. Not pain, not pressure, just an unfamiliar effort when she climbed stairs. She assumed she was getting older. She assumed she was a little out of shape. She cut back on her walks. She stopped taking the stairs at her daughter's house. For 6 weeks, she said nothing to anyone, because she didn't want to seem like she was overreacting. She was not overreacting. What she felt was a real signal from her body. Her heart rate had been slowed more than she was comfortably tolerating. Once that was identified and addressed, the heaviness was gone within days. 6 weeks of unnecessary worry, 6 weeks of reduced activity, 6 weeks of diminished quality of life, all because she didn't have the information she needed. That is the gap I want to close today. Here is the most important thing most people don't know. Blood pressure medications are not one category. They are not interchangeable. They do not all do the same thing in the same way. Metoprolol is a beta blocker. It works by blocking the effects of adrenaline on your heart. Your heart beats more slowly, with less force. Blood pressure comes down as a result. Hydrochlorothiazide is a diuretic. It tells your kidneys to excrete more sodium and water. Less fluid in your blood vessels means less pressure, but less fluid also means less of things your body depends on, and that creates a specific category of risks. Verapamil is a calcium channel blocker. But not just any calcium channel blocker. It also slows the electrical signals moving through your heart. That makes it useful for certain heart rhythm issues, but it means it has a more direct effect on the heart itself than most people expect. 3 completely different mechanisms, 3 completely different side effect profiles, 3 completely different things that can go wrong. Once you understand that, you stop applying a one-size-fits-all interpretation to your body's signals. You start asking the right questions. Let's talk about metoprolol first, and the side effect that is probably the most underreported symptom in all of cardiology: fatigue. Not the normal tired at the end of the day kind of tired, not the kind that a good night's sleep fixes. A deep, heavy, bone-level fatigue that makes things you used to do without thinking feel genuinely effortful. Climbing stairs, walking to the mailbox, carrying groceries from the car. The kind of fatigue that makes a person think quietly and with some fear that they are declining faster than they expected. Here is what is actually happening. Metoprolol slows your heart rate. That is the point. But your heart rate is also your body's main mechanism for responding to physical demand. When you walk upstairs, your heart is supposed to speed up to deliver more oxygen to your muscles. On metoprolol, that acceleration is blunted. Your heart cannot respond as quickly or as forcefully as it used to. So physical activity requires more effort. Recovery takes longer, and you feel it as exhaustion. This is not heart failure. This is not your body deteriorating. In many people, it is simply metoprolol doing its job. A little too well for that person's individual physiology. But here is where it becomes genuinely important. Many older adults interpret this fatigue as aging and start reducing their activity in response. Less walking, fewer stairs, less movement overall. And reduced activity in older adults creates its own cascade: muscle loss, balance problems, increased fall risk, declining mental sharpness. The medication side effect, left unidentified, becomes the trigger for a whole secondary pattern of health decline. The right response is not to simply endure it. The right response is to name it to your doctor. The dose may be too high, the timing may be off, there may be a different beta blocker your body tolerates better. There are options, but none of them happen if you stay silent. Have you ever experienced unusual fatigue after starting a heart or blood pressure medication? Drop your experience in the comments. You might be surprised how many people recognize exactly what you are describing. There's another side of metoprolol that almost nobody talks about: what it does to your sleep. Beta blockers can cross what is called the blood-brain barrier. They do not stay confined to the cardiovascular system. They reach the brain, and in the brain, they can interfere with melatonin production, the natural hormone that regulates your sleep cycle. The result is often vivid, sometimes disturbing dreams, difficulty falling asleep despite genuine tiredness, waking at 2 or 3 in the morning for no clear reason, sleep that never feels truly restful, no matter how many hours you spend in bed. If this sounds familiar, and you are on metoprolol, the connection may not be obvious, but it may be real. There are timing adjustments and alternative formulations that can help. You do not have to accept disrupted sleep as the permanent price of controlled blood pressure. Now let's move to hydrochlorothiazide and the hidden depletion that makes it one of the most nutritionally significant drugs in common use. When hydrochlorothiazide tells your kidneys to excrete more sodium, it does not stop there. It also increases the excretion of potassium and magnesium. And potassium and magnesium are not minor background nutrients. They are electrically active minerals. Your heart depends on them, your muscles depend on them, your nerves depend on them for basic function, every single day. Potassium depletion has a very specific pattern of symptoms: muscle cramps, particularly in the legs, often at night, general weakness that feels different from tiredness, a true physical weakness in the muscles themselves, occasional heart palpitations, a fluttery, irregular feeling in the chest, sometimes constipation. Magnesium depletion adds its own layer: difficulty sleeping, anxiety, heightened sensitivity to stress, muscle spasms that can feel alarmingly like cardiac symptoms. Now here's the part that is critically important for many older adults. If you are on hydrochlorothiazide, and you are also taking an acid reflux medication, a proton pump inhibitor like omeprazole or lansoprazole, you may be dealing with double depletion of magnesium. PP is reduced magnesium absorption from the digestive tract. At the same time, hydrochlorothiazide is increasing magnesium excretion through the kidneys. The combination can drive magnesium to levels that cause real, noticeable symptoms. And the connection is almost never made, because no one thinks of the two medications as related. This is why these medications require active awareness, not passive compliance. Your doctor needs to know everything you are taking, not just prescriptions, over-the-counter medications, supplements, antacids, sleep aids, anything that goes into your body regularly. There is a scenario involving hydrochlorothiazide that I want to address very specifically, especially for those watching from warmer climates, or anyone heading into summer months. Hydrochlorothiazide works by reducing fluid volume in your blood vessels. That is the mechanism. Now put that mechanism together with a hot day, outdoor activity, even modest sweating. Your body is already losing fluid through perspiration. Your kidneys, under the influence of this medication, are simultaneously excreting more fluid than they normally would. The result can be rapid dehydration, much faster than you would experience without the medication. And dehydration on hydrochlorothiazide does not just make you thirsty. It can cause your blood pressure to drop significantly. It can cause dizziness, lightheadedness, and fainting, particularly when you stand up quickly. It can concentrate certain electrolytes in your blood to levels that affect your heart rhythm. And in older adults whose sense of thirst is already less reliable than it was at 30, the dehydration can progress significantly before they realize something is wrong. The practical guidance here is simple: on hot days, in warm environments. During any activity that causes sweating, your fluid intake needs to be intentionally and proactively increased, not waiting until you feel thirsty, drinking before you feel the need, and knowing the signs: unusual fatigue, darkened urine, a headache that does not respond to its usual remedy, dizziness when standing. These are signals that your body needs more fluid right now. If you have never talked to your doctor specifically about heat and hydration on this medication, that conversation is worth having before summer arrives, not during a heat wave when you are already symptomatic. Now let's talk about verapamil and a danger that is almost invisible until it isn't. Verapamil is metabolized by your liver, and it interacts with a remarkably wide range of other substances through a liver enzyme system called CYP3A4. Without getting lost in biochemistry, here's what this means practically. Certain foods and medications change how your liver processes verapamil. which changes how much of the drug is active in your system at any given moment. The most well-known example is grapefruit. Grapefruit and grapefruit juice inhibit the enzyme that breaks verapamil down. The result is that verapamil accumulates in your system at higher levels than your prescribed dose was intended to produce. Higher levels mean a more pronounced slowing of your heart rate, a more significant drop in blood pressure, and a greater risk of the symptoms that come with both. Grapefruit is often seen as a health food, high in vitamin C, associated with weight management, common at breakfast, a senior who is carefully eating well. Drinking their morning grapefruit juice because they believe it is good for them may be quietly amplifying their verapamil dose, without any awareness that this is happening. This interaction is not subtle, it is clinically significant. If you take verapamil and you consume grapefruit in any form, juice, whole fruit, or products that contain it, this needs to be discussed with your doctor or pharmacist immediately. But grapefruit is only part of the picture. Certain antibiotics, antifungal medications, and even some herbal supplements, St. John's wort being the most common, can shift how verapamil behaves in your system significantly. This is not a medication where adding something new to your routine is neutral. Every addition is a potential interaction, and every interaction deserves a conversation. I also want to address what happens when verapamil is combined with certain other heart medications, because this combination is more common than most patients realize. Verapamil slows the heart rate. Beta blockers like metoprolol also slow the heart rate. When they are combined, the additive slowing effect on the heart can become problematic if the doses are not calibrated precisely, and the patient is not being monitored appropriately. Symptoms to watch for in this context: a pulse that feels very slow, unusual breathlessness with minimal effort, episodes of near fainting or actual fainting, a persistent, unusual heaviness in the chest. These are not things to quietly monitor at home. These are things to report to your doctor promptly. Let me now address something that creates enormous unnecessary anxiety for people managing blood pressure at home. The home reading that doesn't look right. You check your blood pressure in the morning. It reads higher than usual, or lower than usual, or you check it twice and get two different numbers, and in that moment, a wave of anxiety arrives. You take an extra dose. You skip your next scheduled dose. You call the doctor's office in a panic, or worse. You do nothing but worry about it for 3 days. Here is what I need you to understand. Blood pressure is not a fixed number. It is a continuously moving measurement that responds to dozens of variables within a single hour. How well you slept, whether you had caffeine, whether you are in pain, whether you are anxious about the reading itself, whether you walked in from outside 5 minutes ago, whether you just had a frustrating conversation. A single high reading on a Tuesday morning after a bad night of sleep is not evidence that your medication is failing. A single low reading after spending the afternoon in the heat is not evidence that your medication is too strong. What is evidence of something meaningful is a pattern, consistent, repeated readings over multiple days and different conditions, showing a clear, sustained trend. The right way to use a home blood pressure monitor: same arm, every time, same time of day, after 5 full minutes of quiet seated rest, without talking, rushing, or checking your phone. Take 2 readings 2 minutes apart, record both. Do this consistently. Bring your log to your appointment. Let the pattern tell the story, not the single alarming number from a Wednesday evening. This approach reduces anxiety, makes your decisions safer, and gives your doctor genuinely useful information. It converts home monitoring from a source of panic into a source of real clinical insight. If you have made it this far, and this video is giving you something valuable, type the number 9 in the comments. It is a simple way to let me know you are here, and you are following along. Before we close, I want to say one more thing, and I want to say it plainly, because it matters more than almost anything else in this video. These 3 medications work through their steady, consistent presence in your system. They are not designed to be taken reactively. They are not rescue medications. You cannot skip doses when you feel well. Take extra when you feel worried, and expect the medication to behave the way it was prescribed. Skipping doses on metoprolol is not neutral. Abrupt discontinuation can cause what is called rebound hypertension, where blood pressure climbs sharply in response to the medication being withdrawn. In some people, it can also trigger a rebound in heart rate. That feels alarming, and in those with underlying heart disease, can carry real cardiac risk. If you want to stop metoprolol for any reason, that is a conversation to have with your doctor first. The discontinuation needs to be gradual and supervised. If you are thinking about stopping or changing any of these medications because of a side effect, because you feel fine and wonder if you still need it, because you read something online, or because someone told you a natural remedy worked for them, please make that decision in partnership with your doctor, not in spite of them. The conversation is not always comfortable, but the consequences of going off these medications without a plan are genuinely more uncomfortable. Here is what I want you to take away from this video: not a list of fears, a framework for awareness. You now understand that these three medications work through completely different mechanisms. The side effect profile of one tells you almost nothing about the side effect profile of another. Fatigue on metoprolol deserves to be named and addressed. Mineral depletion on hydrochlorothiazide is real and measurable. Grapefruit and verapamil are not a casual pairing. Blood pressure readings are data points, not verdicts. And the symptom you have been quietly enduring, the fatigue, the disrupted sleep, the cramp that wakes you at 3 in the morning, the heaviness when you climb stairs, may have a name, an explanation, and a solution that is far more available than you realize. Dr. Walker and this channel exist to give you the information that makes you an active participant in your own healthcare, not someone who nods at the prescription counter and hopes for the best. Someone who asks the right questions, knows what to watch for, and brings their doctor real, specific, useful information at every appointment. If this video gave you something you needed, subscribe, because this is exactly the kind of conversation we have here. Drop a comment below. Tell me your name, tell me where you are watching from, and tell me whether any part of this changed how you think about a medication you are already taking. Your health is not a passive experience, and you are not too old or too far along to understand it better. You are here, and that already tells me something. This content is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making any changes to your medications or treatment plan.